Welcome to Part 2 of Section 3 of the Code of Practice Education Series for equine owners. In Part 2, we are going to cover specialized feeding programs for horses, donkeys, and mules. When on free choice forage, most horses will increase their feed intake in cold temperatures in order to meet their increased energy needs. Horses may also voluntarily decrease feed intake as temperatures increase. Some horses may require a more energy-dense diet in cold weather. For this reason, the code recommends that you increase the quantity of forage during cold temperatures and supply additional feeds such as concentrates for horses not maintaining their body condition on forage alone. Moving on to the growing horse, the code requires that growing horses must receive a diet that is adequate for maintaining health, growth, and vigor. Young, growing horses will generally consume 3% of their body weight in feed per day, which is almost twice as much as maintenance for a mature horse. The key principle in feeding young, growing horses is to provide high-quality feeds that are balanced for growth. Their specific feed requirements depend on their age, growth rate, activity level, and anticipated weight at maturity. For foals, the mother's milk will normally meet their nutrient requirements for the first 6 to 8 weeks of life. If creep feed is necessary, it should be provided to foals at a rate of 0.5 to 1% of body weight per day to a maximum of 1.8 to 2.3 kilograms. Consult with a nutritionist or veterinarian to determine if your foal would benefit from creep feed, or when caring for an orphan foal, as specialized knowledge is needed to meet their nutritional requirements. The same formulation of creep feed can be fed to weanlings at a rate of 1% of their body weight per day, up to a maximum of 2.3 to 2.7 kilograms. Weanlings also need high-quality hay that is fed either free choice or at 1.5 to 2% of their body weight per day. Creep rations need to be balanced for growth. Growth rate slows considerably by the time the foal reaches 12 months of age. But even up to age 2, young horses will have higher nutrient requirements than mature horses at maintenance. You must ensure that the total daily ration for your growing horses consists of 13 to 15% protein overall. Depending on the region you live in, the protein content of forage will vary and should be balanced with the concentrate. Depending on the quality of your hay or pasture, yearlings and 2-year-olds may not need concentrates as part of their diet. But you will need to test your hay or pasture to ensure that it is of the highest quality that will provide the extra nutrients required. If your young horse is entering training, consult a nutritionist or veterinarian to ensure the nutritional requirements of the young horse are met. One other consideration when feeding yearlings and 2-year-olds is to feed them separately from mature horses, as the mature horses may be more dominant and not allow the younger horses to eat sufficiently. Horses of similar nutritional needs should be fed together. Horses in work must receive a diet that is adequate for maintaining health and vigor. Dietary energy, which is the calorie content, is the nutrient most affected by increased work. The addition of more energy-dense feeds, such as grain, to their ration is usually necessary for working horses. Good practices when feeding horses include dividing the concentrate ration into at least 2 meals for high-energy diets. Avoid feeding your horse immediately prior to or after strenuous exercise. and ensuring that sufficient salt is provided, as horses lose salt in sweat during work. Another horse that has special nutritional requirements are stallions. During breeding season, stallions have higher energy requirements, similar to the horses at work we just discussed, and must receive a diet that is adequate for maintaining health and vigor. Although the energy expended by the stallion during mating is modest, the additional activity or changes in behavior and excitement, such as pacing or nervousness, can substantially increase energy needs. Adding extra feed or supplements will not enhance fertility for stallions already receiving a balanced diet. As the end of breeding season approaches, stallions in good body condition can be tapered down to a maintenance diet by increasing their forage and decreasing the concentrate portion of their ration. Take advantage of the months prior to the breeding season to ensure the stallion's body condition is appropriate. The body condition scoring chart can be found in the resource section of this website, or Appendix D and E in the code. Just like with stallions, proper nutrition is important for mares and genettes during breeding season. Pregnant and lactating mares or genettes must receive a diet that is adequate for maintaining health and vigor, and that allows the mothers to provide adequate nutrition to the foal. Proper nutrition improves fertility and promotes normal growth and development of the fetus. The energy requirements of mares and genettes increase significantly during the last 3 months of gestation and are the greatest during the first 3 months of lactation. There are advantages to including a small amount of concentrate, such as 0.5 to 0.75% of body weight, during late gestation. These advantages include supplying the energy needed while reducing the amount of hay she needs to consume, as the growth of the foal can compress the mare's digestive tract, reducing the capacity of her digestive system. Concentrates may help the mare's increased nutrient requirements when the nutrient content of hay is poor, and it can help adapt the mare or genet to increase concentrate feeding during lactation. You should also consult a nutritionist or veterinarian to ensure the nutrient requirements that are of concern, such as calcium, phosphorus, and micronutrients during pregnancy and lactation, are met. Mares need to be provided diets that have sufficient protein at different stages. They will need 11% protein during late gestation, 13.5% in early lactation, and 11% in late lactation, or around when the foal is 4 to 6 months old. You will need to supplement with concentrates when their energy needs increase, such as during late gestation and lactation, when the mare or genet needs to improve body condition, or if the nutrient content of the hay is poor. And finally, the nutritional management of geriatric horses, as with all other horse types, must receive a diet that is adequate for maintaining health and vigor. Like other mature horses, geriatric or senior horses will typically require 1.5 to 2% of body weight in feed to meet their daily maintenance needs. Good quality forage is generally a good maintenance feed source, as long as their teeth are in good condition. Dental problems are common in geriatric horses and can result in slower eating, inadequate chewing, and refusal to eat due to pain. Some geriatric horses may need specialized rations because of this. In Section 4, we will be covering dental care, both preventative and maintenance. Weight loss or failure to maintain appropriate body condition in the face of perceived adequate feeding strategies are common problems in geriatric horses. However, old age itself is not a cause for weight loss. Owners need to make an effort to determine the cause and take corrective action. Common causes of weight loss or poor body condition in geriatric horses include underfeeding or giving feeds of insufficient nutritional content, reduced feed intake, possibly due to competition for feed, inability to eat, possibly due to painful dental problems, lack of appetite due to health conditions, increased nutrient requirements due to health conditions, or parasite infestation. You have now reached the end of this section of the Equine Code of Practice training series. Please click the button below to return to the main Equine Code of Practice training page.